The two main types of procedures or classifications of procedures that someone with a brain tumor might have is the first, a resection. That's where the skull is opened up and the tumor is removed at surgery. That removal can be a complete removal or it can be a partial removal, and it depends on the diagnosis and location of the tumor. That particular expectation would be well described by your surgeon prior to surgery, so you would have a feel for exactly what was going to transpire. The reason why someone would have a removal of the tumor versus, say, just a biopsy is because the tumor was a mass and was causing pressure on other areas of the brain, such that removing the mass would be helpful in terms of reducing the person's symptoms and also helpful in terms of controlling that particular tumor. The second type of procedure is called a stereotactic or needle biopsy. That is generally used in situations where the tumor may be very deep. It may be difficult to access to remove, or it may be in a location where if it is removed, the impact on the person's quality of life or function would be significant, and therefore that risk is not worth taking for that particular problem. These are usually tumors that are intrinsic in the brain, that are deeply located and may not have a lot of mass associated with them, such that there's not a lot of local pressure related to the tumor. That particular type of procedure involves a very small incision, a very small little hole that's placed in the skull, and then using imaging and computer guidance, a needle is guided down to the middle of the lesion. Small pieces are taken, and then the pathologist looks at those to make the diagnosis. So the goal of that type procedure is just to get diagnosis. There is no removal of tissue in that of substance in that particular procedure.